Hey everybody, you have made it to Unit 5 Project in Veterinary Science. We are going to talk about medication administration. So, why do we care, right? So if you had a sick pet, or if you were sick in the hospital, or had to go to the doctor, you would want your provider to, number one, prescribe the appropriate medication for your medical concern, and prescribe the correct amount, and given the proper way, because all of these things are important for the medication to work appropriately and for you to get better. So, this is a huge part of a veterinarian, vet tech, all of those parts of careers working together to, this is the reason you become a veterinarian, right, is to make pets healthy, better. So, you are going to step into a veterinary technician's position here, as if you were working in the ICU, the intensive care unit, with a pet hospitalized with gastroenteritis. What is gastroenteritis, you might ask? It's inflammation of the gastrointestinal tract. Generally, these guys don't feel very good. They don't want to eat. They might have vomit and diarrhea, things like that. And you are given a treatment plan from your veterinarian for certain medications, certain doses, and you are going to determine why those medications were prescribed, the amount of medication you are prescribing or you are giving, and how you're giving that medication. Okay? So, some things to review here. Remember, we have the 5 rights. The 5 rights of drug administration. So, to make sure animals get the care they need. Is it the right drug? The right dose? The right patient? That's important. Right time, right route. Okay? All of those things, you need to pick the correct thing for the medication to be given the best opportunity to help your patient. The route matters, right? So, are you giving it once? Are you giving it twice? Are you giving it every day? Are you giving it orally through the mouth? Are you giving it IV through a vein? Are you giving it IM, intramuscular, into muscle? Are you giving it subcutaneous, under the skin, right? So, lots of different ways that medications are given. Topical, I often forget that one because it's the least one that we use in emergency medicine. And this is going to walk through each and every type of route of giving medication. So, keep that one in mind. And then medical calculations. So this is so important. You need to be able to do some very minimal math in order to properly dose a medication for a patient. So you need 3 things: the body weight of your patient, the dosage of your medication, and the concentration of your medication. So the dosage is how much your doctor wants to give. The concentration is a standard of whatever your medication comes to you in. So, gives you a formula here. You are going to take the body weight times the dosage and divide by the concentration. You have to be a little pickier because of your units, right? This is a science course. Units are important. If you start with X, you want to end with Y, but you have to make sure everything matches up in order to get to Y. So, for example, all of your medications, generally from a doctor, for a dose is going to be in milligrams per kilogram. So in the vet world, we don't use pounds. Okay, you're going to use kilograms. How do you get from pounds to kilograms? Right here. You're going to take your weight in pounds and divide by 2.2. And there you get your kilograms. Then you can move on to your next step, using your dosage from your doctor. For example, midazolam is used to stop seizures. These are the general dose ranges for a pet. Generally in ER emergency world, to stop a seizure is 0.25 milligrams per kilogram. So you're going to take your weight of your patient. Say they weigh, 50 pounds. You're going to divide by 2.2. So it is 22.7 kilograms. You're going to multiply by the dose, 0.25 milligrams per kilogram. That is going to give you your milligrams because you're canceling out your kilograms. And then you're going to divide by I guess there's an example down here, by the concentration of midazolam, which is 5. So your patient is going to get 1.1 mils of midazolam. Okay, another good example here. And another good video here. So, let's get back to our project. So, your veterinary hospital has admitted a 50 kilogram dog into the ICU with severe gastroenteritis. As a veterinary student, you will need to understand the medications prescribed and calculate appropriate dosages. Research each medication below and provide the following information. So, 4 medications here. First is Cerenia, also known as Maropitant. You're going to calculate the proper dosage for a 50 kilogram dog. Your dose is 1 mg per kg. Pantoprazole, also 1 mg per kg. Buprenorphine, 0.01 mg per kg. And fluids. You're going to determine the maintenance fluid rate for a 50 kilogram dog using this formula. So, you have 4 medications, and you have all these things you need to answer. Okay? So, I know it might seem overwhelming, but as you get going, it's going to make sense. So, you're going to tell me the primary therapeutic use. So, for example, go back up. Cerenia is used for blank. The route of administration, Cerenia is most often given blank. The dose for a 50 kilogram patient of Cerenia at 1 mg per kg is blank. The frequency of administration, you should give Cerenia blank this often. Any specific considerations for administration? Any side effects? Any concerns? Does it interact with other medications? Total fluids needed per day and per hour. That is from this bottom one. And explain why each medication is important. It's going to kind of wrap up with this one, the primary therapeutic use. Okay? And then you're going to redo all of these for pantoprazole and buprenorphine as well. Okay? Show your mathematical calculations, please, so I can determine if you are making any sort of mistakes. Use proper medical notation. That means use proper units. Okay? If you just say 1 of Cerenia, I'm going to say 1 what? 1 gram, 1 milligram, 1 mil, 1 kilogram. I don't know. You tell me. Consider potential drug interactions, as I mentioned. Explain why these combination of medications create an effective treatment plan for gastroenteritis. Okay? So make sure you include all of those things. Think like a veterinary technician or a veterinary student in your ICU with your first patient with some gastroenteritis and make them feel better. Good luck. Let me know if you have any questions.